So we have a panel from all of our combined elementary schools, okay? This is
Go
fun.
team.
Okay, we are officially live, and we're just going to give the parents a few minutes just to get themselves logged in, and we'll get started.
Okay.
So also, just so you know, only the person who is speaking is visible to the YouTube, is how it works.
I did not know that.
Looks like Dr. Adley is going to join us, and he can get us started.
How many people are logged on so far?
We have about 9 right now.
Hi, Dr. Adley.
Hello, Shirley. How are you?
I'm very well, thank you. Yourself?
Morning, everyone.
Morning.
Or good afternoon. Sorry, I just took,
Just turned to afternoon.
where did the morning go?
I know, it's all a blink.
Where did the summer go, right? Sure, to our parents too. I think they're live too. So I'm sure the summer went by for everyone quickly. Are we ready to go, Kristen? Or?
Yeah, we could get started.
Okay. Are we live? I think we are, aren't we?
Yeah.
Okay. Well, good morning, everybody. Again, to those of you who are joining us, thank you for joining the Supplementary Services planning meeting or information meeting, more to the point, where you learn about your the resource room and the related services, how they're being delivered. You get a big overview, basically, of the hybrid plan, how it pertains to related services that are being provided. So I hope your kids are looking forward to coming to school. We are certainly looking forward to receiving them. And it'd be nice to see children back in the building after this long time. And we've taken a lot of precautions, as you know, to make sure there's a health and safety for students and staff to return. So thank you for your partnership along the way. We appreciate it as you prepare to send your students and as we were prepared to actually receive them next week. We have our elementary staff here, special education staff, administrators. I want to thank all of them for the extraordinary job that they do, but also to the people who work directly with your children, our professional support staff. Know that preparing to receive our students who receive support services is always a priority to us. And I hope if I could reach out through YouTube here, I would hope and think you would recognize that they do a fabulous job at that, and that they are certainly first and foremost in our minds in many cases. So we thank them for that. You'll have a wee opportunity to ask questions at the end of this session. But with that, I'm going to turn it over to our Assistant Superintendent for Special Education Support Services, Shirley Klein, and I will wish our families a nice weekend, and as we look forward to accepting and returning our students. So anyway, have a good workshop, everyone. Shirley, it's yours.
Thank you so much, Dr. Adley. Good morning to all of our families. And Darien, thank you for finding time to join us today. We do have a panel of different members from our elementary schools, over the 5 schools joining us today. There may be some we can't see because I've learned that I can't see everybody, but if I may just introduce the members that are on screen. Dr. Mullen, our principal over at Royal. Hi, nice to see you. Natasha Torre, our assistant principal over at Royal as well. Christina Ulrich, our assistant principal over at Oxbridge, and Dr. Forshaw is there, also principal at Oxbridge. Alex Harvey, assistant principal over at Holmes. Thanks for joining us. Julie Drovler, principal over at Hindley. Joanne Bordren, one of our SES facilitators over at Holmes. Nice to see you, Joanne. And our program directors, Scott McCarthy, Dr. McCarthy, our program director for secondary, and Kristen O'Reilly, our program director for elementary. Anyone who's not on screen that I have not been able to say hello to, thank you all for joining us. We know there are teachers there, paraprofessionals there, related service providers, and other building administrators. So thank you all for joining us today. The protocol for today of our program is really an overview of the supplemental services that we have in elementary school. Those are our programs that are for students who are participating in general education classes and receiving related services, resource room, and other push-in and pull-out services. I do want to speak a little bit about the forum today and how we'll be conducting today's meeting. We've allowed an hour for the meeting, and we'll have a brief overview, this is for half of that time, that will really speak to the different hybrid implementation for these supplemental programs. And then the second half of today's meeting is really for Q&A, to answer some of the questions, if not all of the questions that we can, that you have after our presentation. And also to understand that what we don't get to, we certainly will respond in our FAQ or direct you to people in your buildings that really can best answer their questions about your specific children. So that's how we'll spend our time today. I do want to just remind everyone that the presentation is public, so please don't use any identifiable student information in your questions. Also that we're going to ask you to submit your questions to reopening@darienps.org. We've highlighted that today. And at any point during the presentation, if you'd be kind enough to submit your questions to that address. Dr. McCarthy, our secondary program director, will receive your questions and sort them for the end of the presentation. And I think Kristen O'Reilly, you'll be able to help connect those and review them for today's presentation. There will be a follow-up FAQ at the end. So let's look at our presentation overview. We're going to look at the general and special education building hybrid models. We'll look at the supplemental programs in our K-5 elementary schools. We'll also have a chance to really look and speak to related services and paraprofessional support and what that will look like. We'll talk about PPT meetings and evaluations and how during the hybrid re-entry to school, we'll be able to begin to access those opportunities. We'll also speak to the physical distancing PPE protocols and the district safety protocols. If we may direct you though to our school opening website, earlier this week, Dr. Adley, Elisa Casucci, our Director of Nursing Services, Dr. Timothy Kennefack, our DPS Medical Advisor, and Dr. David Knopf, our Director of Health for the town of Darien, did a presentation really looking at physical distancing, PPE protocols, environments, and district safety protocols. So please visit that presentation on our website as when you have time. Thank you. At the end, of course, we'll go to our questions. So I'm going to turn it over to Kristen O'Reilly, our Program Director for Special Education in Elementary School. And Kristen, why don't we begin with the hybrid model for elementary general education programs?
Sounds good. Thanks so much, Shirley. So thank you so much for joining us, everyone. Many of you, if you were able to join the elementary presentations that took place on Monday afternoon, you would likely have seen some reference to the elementary general education hybrid model and program. So some of this might seem familiar to you, but we thought it would be a nice place to start as sort of a general overview. So all students in Group A with the alpha split that's shown on the screen would be attending in-person school and services on Mondays and Wednesdays, with the Group B split on Tuesdays and Thursdays. Opposite those in-person days, our students would be receiving instruction and receiving their services remotely, much like we've been experiencing over the last several months due to school closure. So those remote sessions will look a lot like what we just sort of have experienced. This will allow for us to run this 50% capacity, maintain the guidelines and the guidance from the state, ensuring that our staff and students are healthy in maintaining our safety protocols and safety distances within our classrooms and across spaces within the building. On the off days, that also allows for the buildings to be cleaned to ensure that it is safe for students to return on their on days. Much like what we just experienced, students will be participating in synchronous and asynchronous learning experiences, very similar to school closure, and we'll have a real opportunity to be working with our students when they are back with us in person on the in-person days. So we're very much looking forward to welcoming our students back. On Fridays, we have an opportunity for our students to have some practice and review, reinforcement of skills and strategies during the morning session. In addition, from a special education perspective, we'll have an opportunity for students to generalize their skills and practice a lot of the direct instruction they were receiving from earlier in the week. And then for our staff, as students leave us after the morning on Fridays, the staff will have the afternoon to collaborate and work together. That'll be an opportunity for our co-teachers to meet together, our special education teachers, our general education teachers to collaborate and plan their push-in services and the upcoming plans for the week, as well as engaging in PLCs and other professional development opportunities. We are also taking a look at the cohorting and the grouping of students across all levels in the district, and specifically at the elementary level, we are maintaining grade level cohorts and limiting opportunities for students to be cross cohorting due to health and safety reasons. In some situations, we may need to have students cross cohort, but we're being really mindful of limiting those experiences. And then, as we said before, Fridays also will serve as an opportunity for us to have some enhanced cleaning and sanitization of the building and of the physical spaces that our students and staff will be utilizing. So our continuum of services at the elementary level should be very familiar to everyone joining us today, but just as a recap and overview, since it has been a few months since we've been able to engage in our continuum in person, but we are looking forward to engaging in our continuum in the next week or so. So this includes at the elementary level, our special education teachers who push into our general education classrooms. Our special education teachers also provide pull-out service in what we call our resource room model. And then in addition, we have some specialized programs at the elementary level, which include the DLC classes at Henley and Uxbridge, which really serve as an opportunity for our students to receive modified curriculum, additional interventions and related services, as well as social and emotional development. And then lastly, much like we have across the district K through 12, we have related services, speech and language, counseling, OT, PT, and teaching of the hearing and visually impaired for our students. So more specifically, our students that access our DLC program and supports and services and staff, we are so looking forward to welcoming those students back with an opportunity to attend 4 days per week. We understand that our students, perhaps in this population, have some needs that really require some in-person opportunities. And so we're so excited to be able to provide that for our students and our families as well. On Fridays, students will remain remote, and so we will plan, you'll work very closely with your student's case manager in those DLC programs to ensure that we are planning out the delivery of any related services or things that we think would be best accessed through remote learning on Fridays, while planning for in-person services and the delivery of that instruction in person that we think wouldn't be as easily accessed remotely. On Fridays, like we stated before, there will be a shortened day so that we can have a reinforcement of skills and instruction for our students to generalize and practice in the morning, while our DLC staff and the rest of our staff will have an opportunity to collaborate with the other professionals in the building. Maybe even most significantly, in our DLC classrooms, we are planning opportunities to provide lots of PD for our staff for next week to ensure that everyone's feeling safe and comfortable with our PPE, our protocols, and our safety practices that we'll have in place to help support our most significantly impacted population and our students in general. In addition to what we were saying before about the cohorting, our DLC classrooms to maintain safety and uphold the guidance and protocols that the state has provided to districts in Connecticut, our DLC classrooms will remain cohorted, which would include only staff and students who would be accessing the DLC program for the completion or the delivery of services to enter that space as a way to protect and maintain safe cohorting and practices for that population of students. In addition to our special education services, our related services, which include counseling, speech, OT, and PT, will be delivered to the greatest extent possible per students' IEPs, very much in the same way that we tackled this during remote learning, and now we have the opportunity to deliver those services in person. We also are preparing our related service providers next week during our professional development days to become well-versed in our cleaning protocols, hand washing, physical social distancing, and also opportunities for our related service providers really to plan when it might be appropriate to deliver some of their services in person and when it would be more appropriate to deliver those remotely, knowing that we'll have students engaging in the hybrid model. So our related service providers whom we met with earlier this week have already started planning and prioritizing how the delivery of those services. Another group of staff members that we're excited to have back in supporting our students in person are our paraprofessionals. We understand the importance of the support that they provide to our students, sometimes our most significantly impacted students. And so preparing our paraprofessionals with the proper PPE and protocols and procedures for safety and cleanliness is a top priority. Many of our paraprofessionals will be well, all of our paraprofessionals will be engaging in our professional development opportunities next week to ensure that they're receiving proper training. In addition, they, just like before when we were in person and not during COVID, our paraprofessionals are very well versed in working with their case managers and special education teachers in supporting our students. We know that there are going to be times in which it may be difficult for our paraprofessionals or other support staff members to maintain a 6-foot distance for some of our students with some more unique needs. And so some training and scenario, problem solving will be coming in these professional development days coming up next week. In addition, we know that students are going to be utilizing some of our e-learning platforms, Zoom, while they're remote. And so our paraprofessionals received an extensive amount of training during when the district went remote in supporting our students. And so we'll continue to support our paraprofessionals and support staff in supporting our students when they are remote, which may also mean that when students are in person, they may be engaging in these remote platforms so that they can help enter into social groups or strategic grouping set up by their teachers to make sure that they're collaborating and working with students who actually might not be in the building at that time. So we have a real opportunity to utilize technology even when we're in person. And then another group that we're excited to have back with us in person are our part-time consultants and itinerant related service providers who have been providing some service remotely and may continue to provide some of their services remotely. We're happy to have them back in the building after they have cleared some of the health screening protocols that we are requiring all consultants and itinerant service providers to check in with their health office at each building just to engage in a temperature screening and make sure that those providers are safe to be in the building. And in addition, our itinerant and consultant providers have some additional Connecticut state Department of Ed criterion. And so students, remaining in the state versus out of the state, remote versus being in person, we will be mindful of upholding those guidelines for those service providers. And I think we are on to our PPT process, which Ms. Shirley Klein is going to overview for us.
Thanks, Kristen. So we have all our PPT meetings will be held remotely. They'll be done as we return to school until further notice. We're going to limit the amount of people coming into the building, so to keep our students and teachers safe. We will be doing all of our team meetings and our PPTs electronically. We'll use Zoom or Google Meet as our platforms. We also really appreciate, many of us have spoken with parents already, but we appreciate your understanding and recognition that we really are trying to balance the need to hold meetings, to revise IEPs, with at the same time, the need to really engage students in learning. So while we're prioritizing PPTs that need to be done, evaluations that need to be done as well, please work with us in knowing that while students are coming back, we want them in the classrooms, working with their teachers, working with their related service providers, working with their special education teachers, and really looking at current levels of performance. We're also going to look at some of the ESY outcomes. Many of your students have participated in ESY and looking at the data from their programs. What do we need to revisit? Where are we in terms of their benchmark performance? And how we can also get your input, knowing how they did during ESY and during remote learning as we go back and look at present levels of performance. So our SES facilitators are working with building level administrators to really prioritize those missed PPT meetings. So we're looking at annual reviews we were not able to conduct. We're looking at triennials we were not able to conduct. At the same time, we're looking at initial evaluations. So we're looking by building, by students, how we can prioritize and how we can begin to schedule those virtual PPT meetings. Evaluations, and we will be doing a lot during our PD time also. Once we do commence school, again, balancing time in the classroom and time out of the classroom for students, we are going to begin evaluations. We'll be looking at physical distancing protocols. We'll be looking at PPEs during evaluations administration. And we also recognize that the evaluations may take longer to conduct, given the times and the settings that we'll be able to administer those comprehensive evaluations. So we will work with you in arranging times for students to be evaluated, looking at time in and out of the classroom, and we will reach out to you as we have our prioritization protocols in place. Physical distancing, as we mentioned earlier, please go to the website and look at the reopening during a pandemic health and safety overview from earlier this week. But know that our criteria is going to be that staff will maintain a 6-foot distance from students in our hybrid reopening as appropriate based on students' individual needs. We also know from learning from our health safety advisors that mitigating measures such as mask wearing, hand washing, additional PPEs, which we have already providing to face shields, gowns, and gloves, will be implemented. Students will be oriented to physical distancing through classroom teachers, through related service personnel, as well as paraprofessionals who will give them either verbal reminders, there'll be posted signs, and when appropriate, we'll have social stories to really work with some of our younger children and our children who require that intervention to really work out what does mask wearing look like, what can we do to really encourage it. I don't know if we can make it fun, but we can do our best to try to make it something that is engaging and something that students will be able to comfortably model. We've also reached out to families during this time prior to school reopening to say, if you can, whenever available, please have your children wear a mask when you're going out into the community, when you're going into stores, when you're visiting neighbors, so it becomes familiar and as comfortable as children can find the mask wearing. I think that slide is not moving, Kristen.
It looks, there we go.
Okay, thank you. And again, just to know what we do have already in our possession, the health office and services have worked really diligently on making sure we do have disposable masks, we have face shields, we also have gowns and gloves when appropriate, and shoe covers for all of our staff. We do ask, and in accordance with the executive order that was provided from the State Department, that all face coverings, whether it's cloth reusable or disposable masks and clear masks, or gaiters, there are specific questions about gaiters and having double layers on gaiters. I can't speak to that, but please look at the presentation to really know which gaiters would be acceptable. Face shields, again, we will provide them for our staff. And any kinds of gowns, gloves, and shoe covers we have available to our staff. And as well as if students require an extra level PPE, we will be able to provide that as well. I've already spoken to this, but I do want to say that many parents have reached out and have said, what happens if my child can't tolerate or for medical need really can't successfully wear a mask? So we will work with those families to try to help children tolerate them when appropriate, but when medically not appropriate to do, we will make sure that in our classrooms where students are seated and where they are available, that we have extra PPEs in place if they are not able to wear a mask. And it might be location of seating, it might be other PPEs such as plexiglass, it might be other coverings that are available, but please let us know so we can work with you and our health office and nurses to really plan for children who will not be able to wear a mask. Bathroom usage, where students, of course, will still access bathrooms as needed. The bathrooms will be cleaned throughout the day. We will, and I think the principals already have communicated that students will be eating lunch in their classrooms. Again, facing front with all the safety protocols in place. And please know also that there will be specific arrival and dismissal locations where students who are being brought to school by their parents will have arrival areas, and students who are participating in transportation by buses, whether it's special education buses or whether it's the general transportation, there'll be areas designated where those bus and arrival times will be established. Please know that if your child has in the past or is receiving support upon arrival from a paraprofessional, we will arrange that where that location will be, arrange the time that they'll be needed, and of course they will be greeted by the paraprofessional support who has worked with them at a designated area. Once again, and I know Dr. Adley has spoken to this, parents are encouraged to drive their children to school when possible. If they are on special transportation vehicles, please know there will be monitors on those buses. Please know that all students will be required to wear a mask on a bus, again, with medical exception. And please know that students will be seated facing the same direction at all times on the bus. There will be appropriate spacing, and when possible, siblings will be sitting together. Buses, of course, will be cleaned daily after arrival and prior to departure. Thank you for letting us provide the overview. And I think, Kristen, we're ready to go into our reopening Daring PS questions and answers.
Perfect. So we've received several questions. So some of them are special education specific, and some might be better answered by our building administrators. So we're happy that we have them joining us today as well. So one of our questions that has just come through is asking about the use of social stories by our staff members in supporting our students for the reentry of schools in terms of what students could expect school to actually look like.
Kristen, so I'll take this, but I'm not sure if the other panel members are able to unmute or do that. So if we can just check that.
I'm happy to address that, Shirley and Kristen.
Okay.
Perfect.
Thank you,
Hi.
Dr. Cohen. Okay.
Garen Mullen, Royal Elementary. I know that our staff has already been working on some social stories for students regarding the reopening in terms of what schools will look like and also what students can expect in terms of what the day will feel like for them, things that they should know about in the classroom, things that they should know about around the building. If you have any concerns or you'd like access to a social story before school starts, just reach out to your building CES facilitator or administrator and we can work with you on that.
And then similarly, the next question is about staff sending home parents some tips or talking points to help support their children as they begin to imagine what the first day of school is like. I know that you guys, the principals at the elementary level, in conjunction with the APs and the CES facilitators, have been working to create some videos perhaps or some orientation materials to kind of help orient students as they reopen. So if you want to just talk briefly about that too.
Sure. Hi. I was going to say on our to-do list, which you can imagine, we're looking at videos. So we're trying to think about ways to use images, maybe still pictures, maybe videos as our buildings come together and they look as inviting and cheerful for kids as we want them to be, to give families some real concrete, picture. We know that a picture is worth 1,000 words. We're trying to organize that quickly and get that out probably around the time that we are looking at getting our summer mailing information out, so that parents are getting that information in batch. But as my colleague Garen mentioned, if there's a more acute concern that right now your child is really struggling with, we are here and we're here to help.
Great, thanks, Luke. The next question is specifically about movement breaks. So for our students who might require that related to their disability, could we talk through opportunities within the school day where we might be able to provide that, given that many times during the day students might be sort of cohorted to a specific space in the building for the duration of the day.
Again, I don't know if someone's trying to, I think Luke was trying to unmute.
I was just trying to see, I don't want to be an air hog. You'll have some buildings will still have availability for those movement breaks in a facility that is like their OT-PT room, their mini gym, they might call it. So that's certainly an area that we're trying to maintain as designated space for that to happen. We know that in pre-COVID, we really valued having those breaks be a little more fluid and spontaneous, and kids could go in the hall or you set up a chill zone in the classroom. So we want to capture a way to still have that kind of student agency in being able to get what they need. We're just going to do it in a more organized and systematic way. You will get more information about how that will happen for your child once teachers are settled and special education teachers are settled and our OT-PTs are with the building and what the opportunities are. But we are going to be planning for clear, safe places for those breaks to still happen. We know how valuable they are.
And just to follow up to that, Luke, also, Kristen and I had an opportunity to meet with some of our providers and related service providers yesterday, our OTs and PTs, looking at some suggestions they'll have during PD to help work with the staff as well. So they're on it also.
So our next question is about the idea of that when we have special education students returning, in just another week or so, the opportunities to collect new baseline data and then the opportunities for PPTs to sort of be scheduled. And so maybe I'll just start by saying that, I think that when we were talking about specifically the PPT and the evaluation slides that Shirley reviewed, I think one of the messages that we're really hoping to convey today is that we understand and recognize that our students have not been in person with our teachers and with our support staff for quite some time. And so in planning for the reopening of schools, I think one of our top priorities as a team is really just to take some time to re-engage that relationship between students and staff. And as a part of that, we would be collecting some information about where our students are right now in terms of, their understanding of the learning that had been provided. So although we will not likely be starting evaluating students, upon their entering the building, we certainly want to prioritize the relationship and the re-engagement in the in-school environment, and that also it is a priority of ours to find out where our students are right now, so that can help inform the PPT process, which will likely, start to, those PPTs will likely start to be scheduled after the first few weeks. But we understand that there will probably be a lot of team meetings to problem solve and just to have discussions as a team. And that in the event that we're able to hold off on holding some PPTs until our students and staff are feeling like we're sort of back up and running, that we think that that's probably what we anticipate those first few weeks of school to look like. I don't know, Shirley, if you want to jump in and say.
The only thing I would add to that, Kristen, is really that that we really want to be mindful of having kids in classrooms and making sure that they're with teachers in teaching and learning, part of classrooms and getting back. So we want to be mindful of not pulling them out for evaluations as we're returning and re-entering. We also want to be mindful of not pulling teachers out for PPT attendance and meeting attendance as we're first coming back in this model over the next several weeks. So please know that we know you'll work with us. The notion of really having time for kids in classrooms, teachers in classrooms, related service providers in classrooms, and making sure that our kids make that transition back. We will be collecting all that data while they're in those classrooms. Teachers are always assessing students. They're looking at formative and summative. They're looking at curriculum-based assessments. They're looking at kids adjusting socially, emotionally in the classroom. So they are and they will be collecting that qualitative data as well as quantitative, but we will be mindful of getting kids and teachers in classrooms. And as soon as we can, we know we will look for those opportunities to begin evaluations, to begin PPTs, consistent with what we're prioritizing of what has been missed and what do we need to do to support our students.
So our next question has to do with cohorting and scheduling. So not necessarily through the lens of special education, we can talk about the implications of that. But I don't know if Luke or Christina or anyone else from the team wants to talk a little bit about sort of where we've landed in terms of cohorting and the impacts on that hybrid schedule.
Sure. So at the elementary level, I think we mentioned this in the elementary discussion we had earlier. I think it's on the Darien Reopening website page, which if you haven't looked at, it's a really great resource to continue to look at. We're characterizing a cohort at the elementary level as a grade level. So very specifically, we're doing this that we can serve students who might have specialized instruction needs, who might sit in different rooms. So for example, teacher A might have 2 students who receive some reading instruction, and teacher B might have 2 students or a student who receives that reading instruction. They're on the same grade level, so we would have them get that service, and we're still working out the logistics of exactly how that happens. But the intention is that they can serve, that teacher can serve that small group instructionally because they're on the same cohort. So we're scheduling in kind. We're trying to keep the specialized instructors working with a particular grade level, that they're not cross grade level instructing, which very rarely happened pre-COVID, but we're certainly even more mindful of it now. And then we're thinking about the actual spaces in the building that are most effective and safe for those learners to come together with their teacher. Or we're also thinking about ways to leverage technology between learners who might be present in the building, some learners who might be home, so we can use that new technology to bring groups together in exciting ways too. But long story short, the cohorts to grade level, specialized instruction can still reach those kids at that grade level, and they can still serve them effectively and safely.
Thanks, Luke. The next question is about masks and PPE. It's asking, will masks be required to be worn by the teacher and the student during all services?
Yes. Yes, they will.
Can we talk a little bit about opportunities? There's a specific question in here about speech and language services and opportunities for students to have a visual of the provider's mouth.
We have successfully received already several transparent facial masks. Actually, several of us, a couple of principals there, myself and Alicia have been trialing different ones to see which are the most comfortable to wear and the friendliest to wear. So we will be using them when appropriate, and we'll have them available. It's specifically with some of our youngest learners also working in speech and language with our pathologists. Some children also who are have a hearing impairment and also really rely on the visibility of seeing the facial articulation. So we know that we're looking at students, teachers, and groups that may require those masks. Alicia's found one I think is the most successful. We haven't rolled it out yet, but it looks like the most comfortable and has the largest visibility. So I think that's where we are. We've already received several of those.
Great. Can we talk a little bit about sort of sub-coverage, maybe in a general way, for any service providers who may fall ill for a variety of reasons and may need to be remote in some capacity? Just talk through some of the plans that we have in place to ensure that the continuation of the delivery of services happens for students.
I don't know if there was anyone who wanted to speak to substitutes. I know there's a lot of conversation of how that will be in building level subs. If there was anyone who wanted to add to that, or we're in the process of really looking at all the opportunities. I think not everyone could unclick, Kristen. Oh, Julie did. Okay.
Yeah, we do have building subs in each building that will be available. And of course, they will be getting to know all of our students. And so as much as possible, they would work with the special education teacher when they are providing services. In terms of related service providers, that's so specialized. So no, we would not have substitutes for that.
So the next question references our thorough overview of the hybrid model with some questions about parents, or maybe some concerns about parents who have elected to have their child stay home and engage in instruction and services remotely. Can we talk a little bit about what parents might expect some of that remote learning to look like?
I'm happy to take that one as well. Oh, go ahead, Luke.
Yeah,
Please.
You want me to continue? So it will be a combination of synchronous and asynchronous learning. There will be certain times throughout the day, for example, morning meeting, our differentiation block, and a closing circle, when those will be times that will be scheduled in advance and parents will be aware of them. We have recorded lessons that our curriculum teams are working on that will be provided to students when they are working at home. And there may be times across the day when a teacher will pull a small group or confer with an individual. So, you know, that will all be scheduled in advance so that parents and families would be aware of what times those were occurring.
and just to add to what Julie was saying, the notion of we're coordinating whether with technology or looking at related services, looking again of understanding there will be some live streaming, some synchronous, some asynchronous, and different opportunities based on the timing where those services will be delivered.
The next question is about if a student were to be receiving services in a specialized program and they did not want their child to be attending instruction in more traditional settings, do they have the opportunity to opt out of some of that to ensure that their child is staying within the specialized program and not cross-cohorting?
So what I share about that, Kristen, you said this well earlier, is that we're going to have some team meetings early on. And I echo you and Shirley completely in that we want to prioritize getting kids in and faculty in, but there will be some specialized conversation we need to have early as a team. So it's hard to say in general terms what that would be, but we absolutely hear from families, hear their concerns, and try to work with them to address them. But we do that at a team level, I think.
Perfect. Thanks, Luke. So the next question actually is not necessarily a special ed related question, but I've received a few emails with the same one, so it sounds like it's worth asking. Can the building administrators just clarify sort of that first day of school? I think there's confusion as to if the first day of school for students is Thursday, September 3rd or Friday, September 4th.
So I can jump in.
Yeah, happy to. So the answer is both. For our students with the last names L through Z, your first day will be on Thursday, September 3rd. That is a half day in person. For our students with the last names A through K, your first day is Friday, September 4th. And that is also a half day in person. There's not going to be remote instruction those days for our students that are doing remote learning only. You'll be hearing more from your building administrators about specifics But for our students in the hybrid model, that Thursday, September 3rd, for last names L through Z, half day in person. For our students with the last names A through K, it'll be Friday, September 4th, half day in person.
Thank you. Thanks, Karen. The next email that we received actually includes an interesting observation. So this parent is describing that during e-learning, a really, really positive thing that came out of this experience was they were able to really better understand their own child's strengths and weaknesses with regard to instruction and learning. And they're looking for opportunities to share that information with their child's teacher going into the next school year. Can we talk through opportunities for that?
Sure. I think I would suggest sending an email to your child's teacher as well as your child's case manager and asking to set up a phone conference or a Zoom. And I am sure that they will work on that with you. I would ask, at least in my building, that you allow at least a week or two to go by for your teacher to get to know your student so that they have some initial impressions and understanding of how they learn and what their skill set is, because that will help them better engage in a conversation with you about next steps. But definitely we want to hear that because it would be very helpful.
And Paula, just to add to that, please also, you're encouraged to reach out if there are some particular social emotional learning areas that you've learned about. You have your psychologists within the buildings also, in addition to your administrators, your teacher and your special education teacher. Please be comfortable reaching out to the psychologist in the respective buildings. They want to hear from you also, and they want to prepare for your students' reentry.
And on that note, Shirley, actually, the next question that we have is related to anxiety that students might be feeling upon returning, which we can all imagine and anticipate could be the case for some of our students. The question is really specifically asking plans that the district has to help address that and help students re-engage in the process who might be feeling quite a bit of anxiety.
I can jump in again. We have set up times in everyone's day, general ed and students with special needs. So everybody's day has additional time for check-ins, for social emotional supports, and even instruction on how to manage emotions, how to cope with things that are stressful. There are also some breaks in the day that are built in so students can do some self-care or get the wiggles out. So there are lots of different things built into the day. So we have prioritized social emotional learning as one of the most important things, especially upon return, but throughout the school year. And we do have 2 school psychologists in every building who are divided up among the grades. So one school psychologist will work with kindergarten, 2nd and 4th grade, and the other school psychologist will work with students in grades 1, 3, and 5. And your building administrator will let you know who's assigned to which grades. And you can also reach out directly to the school psychologist if your child has specific needs. If you do that, though, I would ask that you include the case manager and the classroom teacher as well. So we're all in the loop. Thank you.
Thanks, Paula. This next question.
Mary, did you unmute yourself?
I was just going to add on, Paula said some more of it, but the other thing we have to add is next week's professional development for all staff has a focus on social emotional as well as other items, safety and health. So we have many more professional development days really with that focus.
Mary. The next question we have is about when parents could anticipate being informed about provider placements. So special education teacher, kind of case manager assignments in addition to related service provider assignments.
I can answer that. So as you can imagine, our class lists and our case managers are changing, not as much as people may think, but we don't have anything firmly in black and white yet. And so as soon as we have the class placements next Friday, the 28th, you're going to receive the letter through Aspen of your child's class placement with the general ed teacher. And after that, you'll receive information from your case manager somehow we'll get the information out to you too for who is your case manager.
Thanks, Mary. This next question has to do with ability to access remote educational environment and resources. Can we talk a little bit about some resources or supports that are in place to help support our students who might find it difficult to access their education or instruction remotely?
Yeah, so one of the challenges in March, because I think a lot of parents are struggling with, whoa, in March, we just basically, Chromebooks, we built the plane where we were flying it, and it was hard. Hard for teachers, hard for families, hard for kids. This is a totally different animal in that we know what we're kind of getting kids ready for in terms of their remote days, even in the hybrid model. So we're going to be doing some instruction with kids, direct instruction with all students in the classroom through their general education teacher, through our wonderful library media specialists, and we're really going to be coaching kids in more regularly to, okay, here is your Chromebook, here's how it works, here's how you access those Google Classrooms, here you access slides, here's how you use the device. So we're very hopeful that actually, teaching kids how to do that in school will have a much stronger carryover for those remote days when they're doing that work at home, and for the impact of potentially other remote days should we have to initiate that.
Great, thank you. And perhaps our last question, although I'll keep my eye on the email chain. And what a lovely question to end with. So this parent is asking, what can we as parents do to help the special ed team during these times?
I'll start there and then invite everyone to please join in. Just stay in touch, work in partnership. We know one of the things we've learned from this is that we need to reach out to you more. So please know that we know to do that, but please do the same for us also so we can partner in bringing our kids back to school safely. Thank you.
Thanks, Shirley. I think that might be all the questions that we have so far. Just out to those that are still watching, we will continue to monitor email. Any questions, feel free to continue to send them along the way, even if it's not during the presentation, and we'll respond either in the FAQ or to parents directly if there are some sensitive questions that we need to respond to. And we appreciate everyone joining us today and being patient with us as we get ready to welcome our students back in person. We're so excited.
Thanks, everyone, and thanks to all the principals, assistant principals, SES facilitators, everyone for joining the panel today. Stay healthy and stay connected, and we'll see you on September 3rd. Thanks.
Good.
Bye.
Thanks, everyone.
Bye.